Hello, my name is Rosemary Hill. I'm a nurse who specializes in skin and wound care. Today I'm going to walk you through the steps of Mepitel Film Application, a dressing that protects your skin while you're going through radiation treatments for breast cancer. Ensure your patient has discussed the decision to use Mepitel film during radiation treatment with their radiation oncologist. Verify your patient does not have a silicone allergy prior to application. It is best to apply the film the day before you start your radiation treatments. Remind your patient to arrive at their dressing appointment with clean and dry skin and to avoid using lotion or deodorant prior to application of Mepitel film, as this will affect dressing adherence. Confirm the following supplies are available prior to the application: 4 sheets of 10 by 25 centimeters, 2 sheets of 15 by 20 centimeters, a pair of scissors, and a felt pen. To begin, have the patient don a gown with the front open. Ask the patient to slip their arm out of the gown to facilitate easy access to the full radiation treatment site. Then place the patient in the position needed for radiation treatment. This is generally supine with the arm raised above the head. It's very important to note the application of Mepitel film should always occur in this radiation position and when repair or patching of the dressing is required. With the patient in the correct position, take one 10 by 25 centimeter dressing, remove the paper backing, and lay the film down on the skin, starting down from the mid-axilla area and landing on the lower chest area. Avoid stretching the Mepitel film, instead gently laying and pressing the film into place. As you apply the 10 by 25 centimeter dressing, place it about 2.5 centimeters beyond the tattoo mark, ensuring suitable Mepitel film coverage to this area. Continue applying more film to cover the breast treatment area. Take another 10 by 25 centimeter sheet and cut it in half lengthwise, creating a 5 centimeter strip. Remove the paper backing from the strip and place the strip where the breast begins, ensuring it lands underneath the inframammary fold and onto the upper abdomen, ensuring there is minimal overlap of the dressing with less than 1 centimeter overlap of the dressing edges. Take the second 5 centimeter strip and repeat the same procedure, taking care to not stretch the film and pressing away any small bubbles in the dressing. Once the breast and upper abdomen area is covered, place the final piece of film, starting at the clavicle and laying it down to the upper abdomen, including coverage of the sternal area, ensuring you are 2.5 centimeters beyond the tattoo mark. Please note, patients with a smaller chest area may only need one 15 by 20 centimeter sheet to cover the entire breast, inframammary fold, and upper abdomen. Generally, the longer sheet is easier to use to ensure complete coverage under the breast and upper abdomen. For mastectomy patients, begin the application using the entire sheet of 10 by 25 centimeter dressing, starting at the clavicle and laying the film straight down from the clavicle to the upper abdomen where the inframammary fold would end. Continue applying the film, working from the axilla area to the mid-sternal area, extending the dressing about 2.5 centimeters beyond the tattoo mark. Finish applying the film starting above the clavicle and extending the film down the chest wall, working medial to lateral, ensuring the entire mastectomy area is covered with film. Reassess all areas where the film has been applied and gently press away any air bubbles. The patient will wear and maintain the dressing throughout the radiation treatment. In our next section, we will discuss tips and tricks in helping your patient maintain their dressing throughout treatment. Explain to the patient that they can shower with the film on, keeping it in place with a hand towel over the film area. This helps prevent further lifting of the film. Excessive sweating tends to lift up the film, so suggest to the patient that they limit intense physical workouts during the course of their treatments. Small areas of Mepitel film can lift over time due to wear and moisture, Ensure the patient understands that it's safe to trim and patch the dressing as needed, as long as there is minimal overlap of dressing edges and the dressing is applied while the patient is laying in the same position assumed during radiation treatment. Once radiation treatment is completed, the patient can remove the film dressing, gently cleanse the skin with a pH-balanced soap, and dry well. Once the skin is clean and dry, a second film dressing is applied for 2 additional weeks for post-radiation treatment using the same technique as above. After the 2 weeks, the film dressing is removed and daily moisturizing to the area should begin. Just as before, take your film and apply over the shoulder blade area on the back. For more information about Mepitel Film Application, check out the link below.